intensely. Today, we have a very hot topic, the effect of government in the College of Health Sciences, Makerere University. Is the board chair of Joint Clinical Research Center and medical director, LifeLink International Hospital. He's also the managing director, Crested Crane, the managing Infectious Diseases Institute. He's the first African Medical Alliance president. He's from Makerere University School of Biomedical Sciences. And he's my namesake, Professor Charles Ibingira. Professor, in the audience are diverse individuals, including family people, business people, professionals, and students. To our esteemed audience, we are looking forward to a great 1 hour of engagement on a topic that affects all of us. Towards the end of the 1 hour, we'll open our lines for questions and comments in the chat room, where we'll be able to respond to the questions or comments that we have. And my name is Charles Barugare, your moderator for today. Colleagues, I have just introduced our distinguished professor, and allow me to request him to greet us, but on a light note, given his profile that I've just enumerated, share with us, how does his typical day look like when he wakes up to the time he goes to bed? How does your typical day, Professor, look like, given this nature of responsibilities you carry? Over to you, Professor.
Yeah, thank you very much, Charles, for the very kind introduction. Good evening to you all, our participants and listeners. I think he has done the introduction and very kindly, so I don't need to go into take care of the overall administration of the hospital, but also I take care of the clinical care hospital. A good number of responsibilities, in addition to also taking care of, I think, Charles, on a day-to-day basis.
Well, thank you so much. Go straight to the topic.
Yeah, thank you very much. Our dear participants, I want to welcome you to this topic, the impact of non-communicable diseases on family finances. And I chose to use the picture of developing countries because these are the ones which are greatly affected by non-communicable diseases. And this is a very important topic because diseases, the community, and my presentation I would like each and everyone to understand what NCDs are or what communicable diseases are. Then I will take you through the cost of care for communicable diseases, right from the moment you know you have the disease up to probably the time you leave this world. But also there is the care by government in setting up diseases, act of the disease, and also on the children, because the children are the future they are our future. Then, of course, I look at the poverty cycle, how the illness and expenses reinforce one another to take you deep into poverty. And not only you, but what surrounds you. The last but not least, I look at the local solutions and then I'll put forward a conclusion of a few recommendations. So just we'll go by that. So I think now I'm quite good to go. And let me take usually simplified communicable diseases. So non-communicable disease transmitted from one person to the other. Whereas communicable diseases, if you sit near a person with a communicable disease, you can easily get it. And a very good example is COVID. I think these diseases affect all ages, but they commonly affect older people and older age groups, and poor people prevalent or affected more. And if you are prevalent or affected more, and if you are a poor person who has made some savings, and the risk factors which I would like to begin with, which are very important for you to know, they include physical inactivity, not being physically active. I will explain that as I get there. The other risk factor is unhealthy diets of things. So non-communicable diseases also increase rapidly in developing countries, and they do not only affect health, but they also out of every 4 deaths in the world are caused by non-communicable diseases, according to the recent publications.
Can you share the slides in presentation mode?
Yeah.
Go ahead then, Professor.
So I'll just continue like this. So the risks begin early and they are often very preventable. I talked about unhealthy diets. People may contain a lot of salt, a lot of fat, and usually carbohydrate. And people consume these foods in large quantities because they are sweet. So those are the ones which predispose you to non-communicable diseases. The other thing is inactive from home in the office. Things are brought there. The conversations are held there. When you want a piece of paper, he has to call an assistant. Enjoys the TV and a big meal of these unhealthy diets, and he goes to sleep. And he goes to sleep. And here factor is early, expose their children to very poor. They drink from the time they start getting money up to a late age, so that they get exposed early. And I think I've already mentioned that they are rising in low income countries, of which Uganda is. We have just entered lower upper middle income. We are a lower upper middle income country, but we still have a burden of non-communicable diseases. So what are the examples of these non-communicable diseases? They are very common, but people do not appreciate them very well. Good examples are the cardiovascular diseases. These are heart diseases, cardiovascular heart diseases, the diseases that affect the heart. And these may include high blood pressure. They may include coronary heart diseases. Coronary heart diseases affect the blood vessels of the heart. They get blocked and the heart does not get enough blood. And when it doesn't get enough blood, it doesn't get enough oxygen. And so it can't perform well. If the situation gets worse, some parts of the heart can start dying, and that's when people get what we call ischemic heart disease, and they collapse and die. And I think you have heard of very many of those. And of course, there is heart failure. There are many other heart diseases. I may not go into detail, but it's important for one to know that heart diseases are some of the most commonest causes of death when someone is still young. They also include stroke. Stroke is when blood vessels supplying the brain are affected. Either they stop taking blood to parts of the brain or they bleed. And then you get someone, depending on the part of the brain that is affected, someone is not able to use his or her body parts. They get paralyzed. And this goes on and starts a cascade of poor health, inability to perform work, inability to earn a living, and you descend into poverty. The other diseases are chronic respiratory diseases. People, I think, know a lot about coughing, but they are chronic respiratory diseases which are caused by air pollution. People cook using biomass, using charcoal, firewood, and they breathe in the smoke. And so their lungs get affected and you find you cannot breathe. Others do a lot of smoking and they are prone to those non-communicable diseases or chronic respiratory diseases of the lung. There are also chronic kidney diseases and the cancers. You also have diabetes, type 2 diabetes, because of excessive eating of and accumulation of fat. The body becomes resistant to insulin and you become diabetic. And this diabetes then leads you to other diseases of the heart, of the eyes, and so on. There are mental health conditions also, depression, anxiety. These can also be a result of lifestyle. Some people do take drugs, alcohol, and so on. Other non-communicable diseases include musculoskeletal diseases. You find someone is not able to walk. The joints are damaged, maybe needs joint replacement, or they have to be on drugs all the time. And this category has quite a number of other diseases, which I don't have time to go into. There are other non-communicable diseases like accidents. They are also non-communicable. No one can infect you with an accident. So I think that gives you a clear picture of the non-communicable diseases we are talking about. But the commonest here in our community are cardiovascular, chronic respiratory diseases, chronic kidney diseases, diabetes, and the cancers. I think everyone knows about the cancers. Now, what is the cost of care of these chronic non-communicable diseases? The financial burden. Now, when you fall sick, you attract what we call direct costs. Those are directly going to the diseases, treatment, and the care. There are also indirect costs. Now, I would like to first take you through the direct costs. Now, the moment you feel you are sick or you get quite a number of symptoms and you feel you cannot stay at home, but even before you start thinking of going to hospital, you have already started buying drugs from a local kiosk. Ugandans have a habit of doing self-prescriptions. You'll find someone going to a pharmacy, buying drugs. And sometimes people initially start with local herbs, then self-medication, and then the disease does not get cured, and now you start to decide to go and consult. So here you are prone to consultation fees. These are paid for every clinic or hospital visit you make. But the government has put government facilities where you don't need to pay. I think if you pay, then that is indirect. You may bribe to pay, but that is not. It is also you need surgery, a surgical procedure, either to diagnose your disease or to treat your disease. For example, if they find you with another cancer, the best treatment is surgery. Actually, if a cancer is caught early, it can be completely cured by surgery. So that attracts a cost. And even when the cancer is advanced, you may need surgery because, for example, if it is a breast, may be having wounds which are smelly, pus, bleeding. So you need to remove these and make it easy for the people who are attending to you. If you have a chronic kidney disease, your kidney is not working anymore, you may need surgery and to do a kidney transplant. That everything you have to do to treat or to find a solution to this disease that is affecting your body, you have to part with some money. That is direct. These direct costs reoccur with every clinic visit, every hospital stay, every prescription, every day of your life once you are diagnosed with these non-communicable diseases. If it is hypertension, you will need to be going to the doctor at least once or twice a month. If it is cancer, once they diagnose you, you may end up the rest of your life going to hospital. You are not going to work. If you own a shop, you will not do your shop. If you are a casual laborer, you will have missed that day. Your kagwira you will have lost it. I mean, if you are whatever you are doing, you leave it and go to hospital. But you also have to go with a caretaker or caregiver who will also leave work, who will also need transport, who will need food, who will need, and you have to leave something at home for the children, the relatives, or you have to hire someone to be there. And so the cost increases. But also when you go to the doctor, he may tell you, you need to feed well, you need to do ABC, which may also need the cost. And if you go to hospital, if you are unlucky and you go to a health center, let's say center 2, they may refer you and say, now your illness, you go to Kampala, where there are many hospitals. You need transport. All those are costs. So direct and indirect costs combined cause a progressive loss of family resources. Definitely you haven't prepared for all this and you have to spend. So the financial burdens now start increasing. So I want to bring to you a scenario. Let's say you have been diagnosed with early breast cancer. What is the cost involved? Let's say for the first 5 years. What is the cost clinics for assessment? That one you already know the cost. Then we may decide to do some investigations, lymph node biopsy, take off some tissue, either breast biopsy on the mass, on the tumor, or or do a lymph node biopsy. You can do needle biopsy, which is less costly, or the doctor can decide to do surgery to get tissue to examine to establish the disease, which is more costly. And that is, after that, if there is a confirmation that you have cancer, then you need a surgery. And here, if it is another cancer, you only do a lumpectomy. You remove that mass, that tumor only. Or you may decide to remove the whole breast for the patient to be safe. And now, when you do that and you carry out some tests, then you may find you need to do some radiotherapy, especially after you have done. But usually we do radiotherapy when we are doing, let's say, slightly advanced cancer. But even for another cancer, to be sure, you do radiotherapy, what we call masanyalaze. Omuntu bamuteka mu masanyalaze ne bamuokerera kulaba nti the whole cancer is, the cells are killed. But also when they do the tests, they may find the breast responds to hormones, the tumor you had responds to hormones, so you may need hormone therapy. That's a cost. They may also decide to give you chemotherapy in selected cases based on the tumor biology, if it responds to chemo. And after that, you have long-term follow-up, including medication, imaging, rehabilitation, and consultations. So once you are diagnosed a cancer patient or any non-communicable, you will always go to hospital for follow-up, for consultation, for medication. It will not end. So even another stage, highly curable cancer requires a long and costly course of multiple treatments. So this is a case I want you to appreciate. So another cancer, if you are to do an estimated cost in Uganda, treatment component, you can see diagnosis may take about 2 to 8 million. Just diagnosis. Then if you are to do a surgery, it may range from 5 to 20 million. If you are to do radiotherapy, though it's government, but the number of times you have to go, the number of days you have to go, what you need, the investigations, it may go 5 to 15 million. If they prescribe hormone therapy for you, you need 1 to 10 million. Chemotherapy may require 5 to 30 million. Follow-up over 5 years may require 2 to 10 million. All these are estimated for over 5 years for a simple breast cancer, simple early stage case. So you may end up in those 5 years, you may end up spending 15 to 50 million. If you do surgery, radiotherapy, and hormone therapy. If you do chemotherapy, you may go up to 150 million. Imagine you are an ordinary Ugandan and you are spending that. So the cost is very, very high. What I'm telling you now is real. So, but if you do this treatment abroad, if you go to India, you'll pay between 5 to 20,000 US dollars. If you go to Turkey, it's a bit costly, 10 to 30,000 US dollars. If you go to USA, 30,000 to 100 plus thousand US dollars. So these direct costs, these are direct costs only. The indirect costs, if you are going abroad, may include travel, accommodation, lost income, and also for the caretaker. So the costs are really very, very high. That's for a simple breast cancer. Let's have another scenario. If you have chronic kidney failure and probably are undergoing hemodialysis. Now, most the most common treatment for a patient with chronic kidney failure, the one who cannot remove waste products from the body naturally, the kidneys are damaged, you need dialysis. You need dialysis, and patients typically require at least 3 sessions of dialysis per week. That's about 156 sessions per year. So dialysis alone may cost 20 to 80 million in 1 year. Medication, blood pressure drugs, erythropoietin, and other drugs may cost 2 to 15 million. Laboratory tests and imaging, because we keep doing tests every now and then. We want to know electrolytes, we want to know protein, we want to know level of blood, and so on, can take 1 to 5 million. Specialist consultation, 0.5 to 3 millions. Transport and caregivers expenses, because by the time you undergo dialysis, you are really weak. You can't go alone. May take about 2 to 10 million in a year. So total annual cost approximately is around 25 to 110 million per year, varying by whether the care is public, if you are going to a government hospital, or private, or where it is subsidized. So this is chronic kidney disease. Now, if you have chronic kidney disease and you opt to undergo kidney transplant, the costs are also enormous. In the first year, the cost, transplant surgery are often done abroad, but thank God these days they are done here. And I think we'll continue to do more here. At least takes about 50 to 150 millions, depending on where you go. You need, when you get someone's kidney, you need to undergo immunosuppressive treatment, because that is not your kidney. Your body will always reject it. So you have to suppress the immunity. And those drugs can take 5 to 20 million. Monitoring and follow-up, 2 to 10 million. And the subsequent years with that kidney may take about 5 to 30 million annually for medication and follow-up. Now, so you can see the total for the first year is about 70 to 230 million. Though a transplant usually offers the best long-term quality of life and may be more economical over several years, but you have to continue spending. So the impact on families, treatment is lifelong unless the transplantation, you may not spend so much. But if you get from a distant relative, or if you buy the kidney, if you get someone who can give you the kidney, then there you have to put in a lot of drugs and a lot of money. So the patient may lose the ability to work regularly, while the family members often become full-time caregivers. If you have a kidney patient in a home, really there has to be someone to take care. Usually the wife or the daughters. Some daughters may live where they are married and they come, or the younger children may be forced to leave school to take care of that person. So, dear listeners, you can see that the cost is huge. And this depends on which facility you go to. If you go to a high-end facility, you pay more. If you go to high-tech countries like USA, you pay more. If you buy drugs from fast pharmacy, you pay more, and so on and so forth. So we can do a simple comparison of costs of NCDs based on Ugandan standards. For 1 year, the cost of care for 1 year for hypertension, you may part with from 0.5 to 5 million a year. For diabetes mellitus, you may part with 1 to 10 million a year. For early breast cancer, you may part with 15 to 50 million. For advanced breast cancer, you may part with 20 to about 300 million plus. Chronic kidney failure, 25 to 110. Kidney transplant, 70 to 230. But of course, I'm looking at a straightforward case. But if you are unlucky, for example, diabetes mellitus, if you are unlucky and you get a wound on the leg and the leg rots and you have to get an amputation, that will push your cost very high. If you are unlucky, you have diabetes, you get a coma, you are admitted, you go to ICU, the cost will go about 10 times. The same applies to hypertension. If you get a stroke, if you get a heart attack, you know. So this is not usually straightforward like I'm reading here. It may have some other hidden costs that may come in once in a while. And so the bottom line usually for chronic kidney failure being among the most expensive chronic diseases to manage in Uganda. Just because we don't have facilities for dialysis, there are very few, and we are just coming up with facilities for kidney transplantation. But also, you know that those facilities are only here in Kampala, and maybe they will be in other cities. So for people who are from up country, it becomes very, very costly. So what is the social and the economic and social impact of these non-communicable diseases? You have already seen the picture of treatment, direct and indirect, but what is the economic and social impact? So there is an impact on productivity. As you fall sick, as you get diagnosed with a non-communicable disease, even if a simple one like diabetes or hypertension, patients become less productive. You have to spend some days going to hospital. If you have hypertension, you may no longer do serious work. If you have diabetes, you have to protect your body. You have to eat less. So you become less productive. Sometimes you may ask for premature retirement because you can't keep asking for permission. Even if you are in a private sector, the employers get tired of you. So, or sometimes you get disabled. If you get an amputation, or if you get a stroke, or if you lose the eyes, then you can't continue working. So the household income falls by about 20 to 80%, depending on the patient's role. I mean, if you are the bread earner, then it will drop dramatically. If there are other bread earners, probably, but they will also be affected. The caregivers miss work. They reduce hours of work. A wife can go to dig. The wife who is used to digging for 6 hours may dig for 2 hours. Sometimes they are forced to take leave because you can't leave a patient at home and you go. The patient may die or may get a problem. And so sometimes you may abandon work entirely and you are there, but you need money, you need food, you need clothing, the needs of life have to continue much as you have this patient. And so it becomes very, very tricky and tough. So even at national level, there are challenges. Non-communicable diseases, they are related to short and long-term disability. And this reduces working age population participation in labor force activities. and it lowers the productivity in government facilities, in government ministries, in private businesses, and so it in turn reduces productivity, and of course it impacts the per capita gross domestic product growth, because you are producing less and the population is growing, so the GDP will be less. So you can take an example where the key person, let's say maybe the head of one of the most important industries in the country, let's say the head of, let's say, Chira Motors, the head is sick and he has, let's say, diabetes. He may come to office late, he may late take decisions, postpones meetings, and so the government facility or business does not flow nicely, and they can't just throw him away. So if there are several Ugandans with similar ailments of non-communicable disease, you can see how these impact on the national per capita gross domestic product. So there is distortion of household consumption. Of course, once the costs are very high, then you have to cut down the budgets. And when you do that, you reduce on almost everything because you have to save money for treatment. And so you may reduce on the essential foods for the children, you may reduce on clothing. Your wife starts dressing poorly, maybe they don't have the luxury of what they used to have, you know, and life becomes miserable. They no longer go for dinners, for excursions, for tours abroad. You know, the children start putting on torn clothes, and this lowers the social well-being of the family. And it is inevitable. That is when you still can afford. Start now a vicious cycle of poverty. And this vicious cycle of poverty, how does it come about? You have illness, you spend. You have the illness brings in medical expenses. The medical expenses reduce the income, either by stopping you to work or by consuming the capital which you had, or by not supervising. Your income reduces. You even use all the savings that you had made. Now, but you still need care if you are the head of the family. Then you say, no, I must get care. I must live on. You go to dates. You may get a date from a friend, but friends will get tired also. Then you may even go to money lenders, and those ones will take you very quickly down. You say now, if you had some assets, you start selling assets. Maybe I know of a friend who had to sell assets to go to India. The money was not enough. We had to contribute, and this usually happens. You contribute, still the money is not enough. When they reach, the estimates are over, the costs exceed the estimates, then they call you to send more money, then you make contributions, you sell part of the land, and here you are slowly descending into poverty, but the disease is not leaving you. And you get more into poverty, the more poor you become, the less affording you can be to the medical treatment, and the poor health now gains ground, and eventually it takes you. But it leaves you and the family in a very bad state. Maybe you have so many debts. If you die with many debts, the family has to pay. If you die after selling all the property, the family is left nowhere. If you die when you are, the children have left school. So it uses up all the savings, consumes the business income, diverse children, school fees, borrowing, and it brings you down. It creates emotional stress in the family. And if you are unlucky, some wives have known of some wives who, when the husband falls sick for a long time, they abandon and they go. They can't stand it. But other honorable women and husbands stay around to nurse their sick ones. So it is terrible. It is terrible. So what is the impact on the education of the children? Because as a family, really, education of the children, if you still have younger children or those who are at university, you need to, it affects them. And some of the effects are delayed payment of school fees. For children, when you don't pay school fees, they get emotionally traumatized. And even at university, I have seen students miss exams because their parents are sick. They keep coming to you, giving excuses. I'm going to sell my land, but these excuses are continuous. So sometimes the children have to drop out of school. And this is a lost potential. A child who does not go to school has really lost. Some of us, if we didn't go to school, would not be what we are. But we are so lucky that our parents didn't get these non-communicable diseases. Some children, after dropping out of school, they go for child labor. Or those who are a bit mature, they also go for casual labor where they can't get enough. And that is a vicious cycle of poverty. The illness of your parent affects you and affects your future and affects your throughout. Children become caregivers instead of going to school. If your children are young girls, sometimes they even get early pregnancies and they become mothers, and you are there looking. You get emotionally stressed, and that can easily even tip you down and you die. And yet the illness is still there. You need treatment, you need care. So when families seek medical care abroad, I've already given you an example, but here people have a tendency of going abroad. Maybe they think there is highly specialized care which is unavailable here, locally here in Uganda, but many times they go and they find what the doctor at the village told them is what they are going to do. But because they have already reached, they have no choice. They just spend money, come back when the illness is not cured, and they continue in the vicious cycle. Some others think there is high quality of service. Yes, there may be high quality of service. There may be better technology, but that technology may not
We seem to have lost you, Professor. Professor, please unmute.
Is it okay? Now, can you hear me? Hello, Charles? Hello? Hello, hello?
Yes, we can hear you, Professor. Go ahead.
So let me share the slides. So going abroad, some people think that is a better choice, but it is a quick drain to poverty. You need to have a lot of money. But of course, the government also feels this because most of the high-placed people in government, they go out for care. And the government pays a lot of money. I should have come with a figure, but it is in billions of shillings. Money which should have been used to put up facilities here, to train specialists, to make services better. They are spent taking our VIPs for treatment outside Uganda. You'll find someone who can consume so much money that can even construct a hospital, or that can build several CT scans, or can. So it is not only the family that is affected, but also government loses a lot of money in seeking treatment for non-communicable diseases outside the country. There are local alternatives that can be looked at for NCDs, and for diagnosis, really, government has done a lot, and even the private sector has done a lot. You get most of these investigations around, like what you can say, we have it available and functioning very well, and we can deliver quick diagnosis to whatever is disturbing you. Even if you need high-tech surgery or high-tech treatment, you can easily get it from around. Now, what are the recommendations that I would give for us to fight non-communicable disease? I think government should aim at primary prevention. That is making sure that people avoid those risk factors early enough so that they don't get predisposed to non-communicable disease. So you need to adopt a healthier lifestyle. You need to eat food which has less sugar, which has less fat, less salt, less carbohydrate, and you need to eat a lot of greens and vegetables and fruits. And you need to avoid saturated fats and frying, so that you are able to avoid these diseases of lifestyle, because those foods which are unhealthy, they affect the body parts, and you end up getting diseases like diabetes, diseases like hypertension, kidney disease, and so on. But also, the government should avoid pollution, because the air we breathe in, if it is polluted, then we get chronic respiratory diseases. I think you are aware that air around Kampala is highly polluted. So the people in the villages breathe in better air than we do, and so they are likely not to get non-communicable disease. We need to avoid taking excess alcohol, smoking, and Uganda has done very well on smoking. There are few people who smoke, but still those are prone to non-communicable disease. But we smoke less, but we take more of alcohol. We need primary prevention, avoid taking a lot of alcohol. Now, once that is done, you prevent the disease before it comes. and prevention is better than cure. So if we cannot do that, if we can't prevent the disease before they come, then let's try and make sure we get the diseases before they get advanced. And that is secondary prevention. So that what is needed here is people going for medical checkups, so that you are investigated and we check for the markers of these diseases, non-communicable diseases. We check for the markers, we check the areas which are prone to these diseases, and you do it regularly. You know, I always joke with people, they take their cars for, the car cannot miss service, but then the owner of the car rarely goes for service, rarely go for, the owner of the car rarely goes for screening. So if you go for screening, like for men between the age of 40 and 70, you need to go for screening at least once every year for cancer of the prostate. For women of around 25 to around 60, you need to go for screening for cancer of the cervix. You need to go for screening for gastric tumors, gastric cancers, and colonic cancers. You do endoscopy at least once a year, once you're above 50. That is secondary prevention, because if we get a cancer in the stomach very early, we can do surgery and you live for a number of years and you spend less. But if you delay and the cancer is got late, then you are going to be very miserable, you are going to spend a lot, you are going to cause social and economic imbalance in your home, and you leave your family in a very poor state. So we need to emphasize, or government needs to emphasize, primary and secondary prevention, building facilities for prevention, and putting bylaws to ensure that people are active, people eat very good food, the environment is safe, no a lot of alcohol, no a lot of tobacco, no exposure to radioactive materials, and so on and so forth. But also we need prepaid medical insurance, which is very rare here. At least if you have insurance, it will take care of some costs, but it may also not be enough. And insurance also does not like old people. When you are old and you are they really hesitate to insure you. But if you have insurance, it is better. Then we need to encourage community education, awareness of risk factors and other symptoms to save money and save life. Once people are educated, they know what to do. That's primary prevention. They will avoid these risk things and they will save that money. We also have to invest in local specialized technology so that our people don't go out of the country and spend more. They can find the service here. It will be costly, but it will be less costly, especially on the indirect costs. Then we need support networks, support groups for patients and caregivers. This is emotional and financial load. These days, actually, there are many circles, and these provide a lot of social support and social capital, and these should be encouraged. And then specialized training. We need to train our own Ugandans to build local specialization, to promote research, so that we can be able to identify the causes of these diseases and we mitigate them. And we can only do that if we do our specialized training, if we are able to do specialized research. Government needs to invest a lot of money in research in these diseases. That's what other countries are doing. like the USA, the Nordic countries, all those which have improved lifespan. So there is a lot we can do. But as a family, as an individual in the family, you should ensure that your family feeds well. Your family does exercise. Your family does not take a lot of alcohol. Your family avoids smoking. Your family lives in a nice environment, not polluted, not using firewood, charcoal, all those things. Your family should be protected. Then you should do a lot of saving so that in case by bad luck you get such a disease, then you are able to stay on and be cared for without causing a lot of stress to your family. I think, dear participants, I would like to end here. Thank you very much for listening to me. I think early detection, local care, community support, and protection, or rather community support, all these protect both health and household wealth. So I think let me end here, and the moderator will advise us on the next course of action. Thank you very much.
Thank you so much, Professor. I think you have done wonders to what we are expecting, and we are excited to have heard from you. It's an honor to get such a kind of person present to us this evening. When you, Professor, you were speaking, I remembered what Bill Gates said, that treatment without prevention is simply unsustainable. And from what you said, Professor, it came out very, very clearly that it's not sustainable. But you have also shared to us that the car does not miss service, but the owner does not go for service. Very strange, but true. And I think we need to do self-reflections and then be able to change some lifestyles. So I want to open the discussion for 5 minutes. And then if there are any burning questions, we should be able to deal with them and then close this. Any burning questions? Sorry, we have gone over 1 hour, but you will allow us because the topic affects all of us. So it's an exception. We don't normally exceed our time. Kindly allow us just 5 more minutes for questions and maybe another 10 minutes for responding, and we close. If there are any questions. Professor, there is a question requiring you to comment on the role of exercises, especially jogging, in dealing with non-communicable diseases, and how much is too much exercise. Interesting.
Yeah, thank you. I can hear an echo. I hope it is not from me. Yeah, the role of exercise in dealing with non-communicable diseases. Yeah, exercise is very, very, very important in mitigating non-communicable diseases. When you don't exercise and you continue eating, it means you are not using the food. So the food you eat most of it is stored. And it is common that most people eat more food than they require. So once you don't exercise, then most of the food is stored. Now, once it is stored, and for your information, most of the food we eat in large quantities are carbohydrates. Carbohydrates are stored as fat. And so this person now will start putting on a lot of weight and will start depositing a lot of fat on the body, under the skin, in the abdomen, around the intestines, and everywhere. You'll find this person very round. He has eaten more than he is able to use, and so most of the food is stored. And now once it is stored, then now you start creating fertility for the non-communicable diseases to come, especially diabetes, because the fat will cause insulin resistance. So sooner or later you get type 2 diabetes. And you may get hypertension. Once you get diabetes, then you may get kidney failure, and so on and so forth. So when you eat and you exercise requires a lot of energy. So you burn most of the stored food and you remain with very little. So you are not able to add on a lot of weight, you don't become fat, you don't get insulin resistance, and you don't get those other complications. So exercise is very, very important. It helps you to burn excessive food, but it also helps you to make your tissues active. The muscles will get maximum utilization of blood, the lungs will open maximally, the brain will be active, the bones will harden, and the body will become strong. It will become more resilient and resistant. And this will give you even more immunity to communicable diseases. So exercise is very, very important. How much should you exercise? Exercise recommended, and scientifically, they recommend at least 30 minutes of exercise. 30 minutes. Do a walk of 30 minutes. It will be enough. But some people, of course, go ahead to do very strenuous exercise. But after strenuous exercise, they also again go back and eat so much. So it's as if you have done no work. You burn the food that you had stored, but after burning it, you even add much more. So you don't need to strain yourself so much that you are so hungry, you are so exhausted, the tissues are damaged. Do light exercise for over 30 minutes or an hour, and do it, be consistent every day. Don't go to an office and you sit. If you need paper, you walk and pick it. If you are sitting at floor 5, don't take a lift. Walk those stairs. If you have to check on something, stand and do it. Most of the damage happens when we are seated. Sitting is very bad. We need not spend a lot of time seated. We need to be exercising our muscles, exercising our lungs, the heart, and every body part. I think that's all I can say about exercise in the interest of time.
Thank you so much, Professor. I see some other questions in the chat room. One is about the need for planting trees, clean the air to reduce
dust and produce oxygen.
That's one. Then the second is about raw salt versus cooked salt. And the third is commenting about eating food based on your blood group. Is there any problem, or it is a good practice to eat food based on your blood group?
Let me thank those who put up those questions. I think planting trees is very, very important. We need good environment. Everyone, it is common knowledge that the oxygen we breathe is produced by plants. And so the plants clear the air of carbon dioxide and produce oxygen. They are very important, but they also reduce dust and they provide shade and reduce the amount of sunshine. So they are environmentally good by replenishing the air we breathe, and also environmentally they reduce global warming by absorbing carbon dioxide, which is one of the gases that promote global warming. Then the other question about raw salt or cooked salt. Cooked salt is better than raw salt because raw salt, when it is cooked, it is mixed up with the food, and so it does not concentrate in one area to raise the blood pressure. But when it is raw, you have eaten it, it goes in one place and it is quickly absorbed, not with the food, and it can quickly raise the blood pressure. So it's advisable you eat cooked salt and avoid raw salt. Although I see on parties, people always add salt, put salt, and encourage people to take raw salt. Now, eating food based on your blood group, I have not found anywhere scientifically where we should eat based on our blood groups. Any food is good for any part of the body, because when we eat food, the body digests it and creates nutrients which are utilized by the body. If there are proteins, you get amino acids. If there are carbohydrates, you get sugars. If there are vitamins, you get, if there are fruits, you get vitamins which are taken up. You get vitamins and minerals which are taken up, and they are needed by everybody, whatever blood group you have. Blood groups come about genetically, and they don't have any influence on the diet that you eat. They have no influence. But some people take advantage of that to mislead others that blood groups require specific diets. But a person with any blood group can eat any food comfortably unless you have allergy to that food. Unless you have an allergy to that food, there should be no reason why you should not eat a certain food because you are blood group O or blood group A or blood group. No. If you have allergy, please don't. If you don't, then eat any food. The blood group is only important if you are going to get blood from another person. It has to be matching blood, but it does not affect the diet you eat. Thank you. I hope I have answered all the questions.
Thank you so much, Professor. We cannot take it beyond this. We want to thank our dear participants for your active participation. Thank you so much, Professor. The information was quite informative. The information is well loaded. People are asking for this presentation. meaning that they are really appreciative of the knowledge you have shared. And this is what we do at Finance Deep here. Every last Wednesday, 6 to 7 p.m., we provide financial and educative content to everyone who is ready to join in. It's free. You can join in every last Thursday. In July, we'll be having the topic succession planning, experiences, and strategies. Please don't miss out. Otherwise, thank you for being a good audience and for your active participation. So, members, we can leave at leisure. For those who have shared their emails, Professor will share with us the presentation and will be able to share with you. Thank you so much, and a nice evening, and God bless you.
Thank you, and a nice evening too, and God bless you. In case you need to contact me, my telephone number is also here, 0772437351. And for any healthcare requirements, you can find me at LifeLink International Hospital, Zana, or we have a Chira branch or St. Mary's Clinic, Mitiana. And we do general body checkups, we do screening for cancers, and for all these non-communicable diseases. Thank you very much, and wish you the best.
Thank you, God bless you, and have a lovely evening. Thank you so much.